mentioned at my last talk that I've known of ozone for years and years and years, and I kind of just didn't pay much attention to it, just like the whole medical community doesn't pay much attention to ozone. So I kind of just put it on some back burner someplace. And then one of the blogs that I get in my inbox is from a doctor named Dr. Brownstein, David Brownstein, who's up in Michigan. And he's written lots of books. He writes books on iodine and thyroid, and I met him at a couple different conferences, and I went to, hi, you can come on in and figure out where to stand. It's a standing room only right now.
Yeah, awesome. This is we all come around and go around.
Okay.
Yeah.
So, you need a bigger location. We thought about doing it outside, but anyway, so he had sent me an email that said that about ozone, and that he'd written a book about ozone. I thought, David's into ozone? I should probably take another look at this ozone thing. And just right then, I got, there happened to be a conference up in Santa Barbara that Carol Ann, who's sneaking around the back here, her husband's a dentist, and he's an integrative dentist right here in La Mesa, which is just wonderful for us to have. So if you need a good integrative dentist that removes mercury and doesn't offer you fluoride and some of the things that regular dentists might do, he's here in La Mesa, and he was going up to this conference up in Santa Barbara on ozone, so I said that I would come along. So I came along. That was my first conference on ozone, and that was just about a year ago, because I just went to the second one in Santa Barbara, which was a year ago, and then I sent Dr. Patel to Dr. Schallenberger's course, who teaches ozone and certifies people in using ozone. So I sent Dr. Patel to that conference, and then I attended that conference and brought Bonnie with me, my IV nurse, to that conference, and then we just went back to Santa Barbara to another conference, and then I attended an ozone masters conference. I tease everyone at the conferences that I came at this, backwards, that I started at the most, the first conference I went to was for people who were already doing ozone, knew exactly everything that they were talking about, and I was sitting there going, now, how do you begin this? Where do you begin with ozone? So I learned a lot. So she went to the most practical conference, which she came back and helped us get more practical about setting it up here in this office. And then I attended that, and both of us are certified in ozone administration. So, so ozone is a gas produced when oxygen is charged, so it's O3 instead of O2. So, and then when you put it into your body, it immediately becomes O2 again. So it's not, when you get an ozone injection or we do ozone into you someplace, immediately it becomes oxygen. So it is an oxygen therapy. It isn't an ozone therapy once it goes into your body. So it's been around forever. So that's that, but unfortunately, as we've talked in this group before, that, the whole medical industry in this country is really run by the whole pharmaceutical industry. And the FDA is at the beck and call of the pharmaceutical industry. So once we became interested in what drug to treat what problem with, that was the whole focus. And anything that they couldn't patent, they're not interested in. So if they can't patent ozone, then who cares about it? It can't work, it can't be any good. And they've actually gotten to say it's harmful, but it's been used forever. It goes back to the first ozone generators were developed in Germany. In fact, the ozone generators that we have here in this office come from Germany. And Dr. Kellogg was using ozone saunas in Michigan in 1880, that they were using ozone saunas. So it's been around forever. In World War I, they used it to treat wounds and trench foot. It's, we think of ozone as kind of an antiseptic and antibacterial, and it certainly is, but it is much, much, much more than that. And I wish you could be at one of these conferences to hear the kinds of things people are doing and how excited they are. And that's part of why we want to start having these regular once-a-month meetings. We won't do one in December, but we will do one after that every month, just so that you can hopefully get a little bit excited about what we're doing and why we are incorporating different things into our practice. So, it's been worldwide. Worldwide, it's been used to treat lots and lots of things. It's used to treat, everything. There isn't anything that doesn't benefit from oxygen. So any disease process would benefit with more oxygen supplied to that particular organ. The positive things about it is that it's inexpensive to produce. The negative things, it's inexpensive to produce, and why that's a negative is it makes people think it's not worth anything. If it's, if they can't patent it, it can't be patented, then the whole medical community isn't interested in it, because right now, all the medical education in this country is coming really through the pharmaceutical industry. And if they can't patent it, then they're not interested in it, then they're not going to be teaching it. So it's not taught at any of the medical schools, and it's extremely safe. These doctors that I meet, when I go to these conferences, there's hundreds and hundreds of them. They've been doing thousands and thousands and thousands of treatments, and there's not any of them that I can see that have caused a problem. Not maybe someone will say, I felt a little funny after that or something, but for the most part, it's extremely, extremely safe. It is complementary to other treatments. It doesn't say, we don't treat cancer, even though ozone is used when people are going through things like radiation and chemotherapy. You can use ozone to support them while they're going through a treatment for cancer, but we're not going to say this is a treatment for cancer. But while someone's getting treated for cancer, there's no reason why they couldn't be supported with some kind of ozone therapy. And then, like I said, there's millions of people, and we're going to refer you to several websites that you could explore at the end of this talk that show of some of these people who are doing so much. This one guy I met from, I think he's from Idaho, he treats about 60 people a day, and I don't know how he does that. This guy's like a little motor. It's amazing. But anyway, so there's ways to administer ozone. We can give it an injection, and that's kind of how I got a little bit interested in it. It was when David Brownstein was talking about doing trigger point injections with it and doing joint injections with it. I thought, really? That would be, I hadn't gotten into using PRP, which is the platelets that people put in, and to do treatments to joints. And I thought, well, this would be a lot easier to do than PRP or some of the other, and better for you than treating a joint with cortisone. I will tell you that treating a joint with ozone, with a joint injection, sometimes requires more than one shot. We have seen it where it is just one shot, but sometimes it requires people coming back for every couple weeks for a shot, and then maybe once a month if it's working for them. I won't tell you it works for everybody, but for the people it works for, it's been amazing for those that it works for. But for some people, it just doesn't seem to do anything at all. Cortisone is, usually when you take a cortisone shot, we think about getting a cortisone shot in your knee or something, and we know that that can last for 3 to 6 months, that you don't need another shot. But, we know that cortisone down the road is going to have a negative effect on that joint health, and that joint is going to deteriorate more rapidly, just like it would if you take Motrin or Advil or any of the non-steroidal anti-inflammatories. They're destroying some of the good prostaglandins that are trying to heal that joint. So we know that cortisone in a joint isn't good for that joint, but it does relieve symptoms for a while. Where ozone is actually nurturing the joint, giving that joint oxygen, helping that joint produce some of the things that it needs. We usually inject, at the same time we inject the ozone, we inject a little bit of vitamins into it. We use a homeopathic called Traumeel that we inject into it, and we use a numbing agent called Procaine, which is actually a vitamin in itself. So we use the Procaine, we use Traumeel, and we use usually some B12, and then we follow it with ozone when we put it in a joint, or if we do it in trigger points. And I think I told the story last time about I broke my foot. I got kicked by a horse, and I had a broken toe, and I thought, I'm going to be laid up for 4 to 6 weeks where I'm going to be limping around here, so I had Dr. Patel inject my foot right above. I didn't go into the toe that was broken or anything, but I went right above where my toes, I had 4 bruised toes, and I went right above that, and within a week I'm just walking normally. Never got a limp, nothing. So it really helped that tissue to heal quicker. So I think it has a real place in traumatic injuries too, along with chronic injuries like arthritis and that. So that was how I, just went back for a second, sorry. That was how I got kind of interested in it. It was by learning about how to inject it. And then when we went off, we learned how to do it intravenously. I'm going to talk about this 10-pass technique in a little bit. But for quite a while now, we've been offering single passes of ozone. Well, what that means is that we draw your blood out, we mix the blood with ozone, kind of shake it up a little bit, and we put the blood back in. So we're ozonating your blood. Once that ozone hits your blood, it's creating what's called reactive oxygen species. And those are stimulating your body to make more stem cells in your body. It's stimulating your body to make more. Dr. Patel in a little bit is going to kind of show what happens when we ozonate blood. And then if you think one pass might be good, then this 10 pass, I'm going to explain to you what that is later. That might be even better. But now when we do a single pass, we do a single pass maybe once or twice a week. Ideally, it would be twice a week if we're fighting something or trying to help something aggressively, and then we go down. If we can do a 10 pass, we might could do it once a month, because when we do a 10 pass, we're going to be taking about a third of your blood out and ozonating it and putting it back in again. So we'll explain that in a minute. And then there's an ozone sauna, which when I was at the Schellenberger talk, and you knew I had a little sauna back here, but mine was a far infrared sauna, which is just a dry sauna. So if you're going to use ozone in a sauna, you have to use a wet sauna. So we had to get a steam sauna. So I purchased a steam sauna. Everybody laughs at me when I come back from a conference. They always say, "What'd you buy this time?" So I purchased a steam sauna when I was in Reno. And one of the reasons I did it, we'll show you a picture here, why I really, when I saw this one picture, I was really convinced that this is something I wanted to do. And I figured if I want to do it, then I would think some of my patients might want to do it too. But it's nice, especially for people who have bad veins and feel like people can't get into their arteries very well, and it's hard for us to get that blood out to ozonate it. Then you could sit in the sauna for anywhere from 15 to 30 minutes and just feel that if your skin's wet, which it has to be in a steam sauna, then you're going to absorb that sauna through your skin. And I'll tell you, we just got it last week, and I did my first, and Dr. Patel, we've only had 2 of us use it so far, but it's exciting. I'll tell you about my experience when you see my picture of me in it here. So, but the door's closed, I promise. And then we can put it in your ears, and we can sell you a home unit for you to do it rectally. Now, rectally sounds like a really ridiculous thing, but I'm telling you, in Cuba, they've been using rectal ozone forever, and they use it for all sorts of things. They use it for all sorts of chronic diseases, macular degeneration. Also, you've got to think, in the medical society in Cuba, they don't have as many pharmaceutical agents to throw at things, so they're much more open to having other ways to treat problems, and they've been using, and because IV is kind of expensive, this rectal thing is really easy, and so you can get an ozone generator at home, and it's important when you get an ozone generator. You could buy one on Amazon for less money than what we would sell you one for if you got an ozone generator at home. Most of those come from China. It's real important that you have the ozone generator hooked up to pure oxygen. You don't want room air to come in there because room air has got a lot of nitrogen in it. So it's got to be pure 100% oxygen. So besides the ozone generator, you need a oxygen tank. And it took us a while to figure out how to get patients oxygen tanks, but we figured that out now. So you get an ozone generator that's a high quality ozone generator, and then you get an oxygen tank, and then you get a tube, and I've done rectals at home myself, and it's an interesting experience. I won't say it's fun, but it's not bad. And ideally, the people who I saw this in the last meeting being used is that they're using it after like a coffee enema. Some of you may have heard about doing coffee enemas for health. And so they'll do a coffee enema or just a regular enema or just evacuate your stool yourself. So you'd want to ideally use the ozone after you've had a bowel movement that day. So you wouldn't want to, you're not supposed to be trying to stimulate yourself to have a bowel movement. You're supposed to be going into that rectal cavity. And again, that is another way for ozone to get into your body, and that's a moist place for you to get, ozone into your body. And immediately it goes through that plexus of veins there up to the liver, and it's very detoxifying. And it's certainly something that you could do every day at home if you had an ozone generator at home, which I do. And I use a lot of ear insulfations. After I did about a month almost every day of rectal ozone, I decided that it might be simpler. Every time I take a shower, I go sit down and I put the ozone in my ears. My ears are wet right then because I just took a shower. So I put the ozone in my ears, and while I'm doing things right there, getting dressed, I sit and do about 10 minutes of an ear insufflation into my ears with a stethoscope attached to my ozone generator. So that's another way. And we have sometimes had patients come in here and given them an ear insufflation of ozone, especially if they're fighting an infection. If my grandkids come over and they're starting to get a cold, I'll sit them down and I'll put the ears on. And they go, Grandma, can I have one of those ear things? So we do that at home. And then we can do it vaginally. And vaginally is good for infections that people could have vaginally, or even for, supposedly even for uterine fibroids. Now, we have no experience with that, but it's been touted to help with uterine fibroids. And, you know, it certainly wouldn't hurt. And sometimes if someone's rectum is too sensitive, let's say they have chronic colitis and they have chronic diarrhea and they've just got a real irritated rectum, then they may not want to put ozone into their own rectum. They may use it in the vagina. Or if they're treating bladder issues, interstitial cystitis, if they're treating something in the bladder, they may use it vaginally. And that's it's obviously it's not quite as tight an opening, so they have to kind of hold that their own vagina closed a little bit while the catheter's in there doing the vaginal insufflation. But those are all ways to get ozone into you. Ozone, Frank Schallenberger, like I said, he's kind of the father of ozone. We give you his website to go to for him later. But he's kind of considered one of the main teachers of ozone in this country, even though there are people who have been doing it longer than him. He got real excited about it when he heard about it. He has people coming to him from all over the world for ozone treatments. And he's the one that does the main teaching and certifies people like both of us have been to. And then conditions help with prolozone, anything. Anything you want to shoot, you can. And I found out this weekend that some people are shooting men's prostates with ozone and helping chronic prostate, you know, hypertrophy and issues with the prostate by shooting the prostate with ozone. I thought, really? That sounds like a pretty painful thing to do. But anyway, I haven't done that. I've heard of people doing that. But there's just lots of things. When it comes to trigger fingers, I've had mixed success. And nothing works better with a trigger finger than shoot a little steroid in it. So it's always so tempting just to say, let me shoot a steroid into your trigger finger, because I know I can get success for a while. Ozone, sometimes what we'll do when we first start injecting ozone, if it's a real inflamed joint, then we'll put a little teeny bit of steroid, not the much we usually use, and then along with the ozone and things like that. But there's nothing we can't shoot with it. And the TMJ one sounded real interesting to me, but we haven't shot anybody's TMJ yet. What we wouldn't want to use in the TMJ is something to numb up, because it's pretty well documented by the medical community that having bad bacteria in our mouth can lead to increased risk of making plaque in our arteries, and having that plaque be more inflamed, and more inflamed plaque can lead to an event. So one of the things we sell out in the store right now is some ozone toothpaste. We also sell the other toothpaste that you guys use over there, which is a probiotic toothpaste. And I have them both. I use one in the morning and I use one at night. So I use a probiotic toothpaste at night and I use an ozone toothpaste in the morning. But I do think taking care of what we have going on in our mouth can lead to better health. So when we use it intravenously, we can obviously use it for an infection. We can also use it to improve circulation. They have all sorts of different examples that I've seen where they've shown that it does regress some atherosclerosis in the arteries. So it is beneficial for hardening of the arteries. It improves your immune system. What aging is, we talked about this a little bit at the last meeting about stem cells. Aging is a loss of mitochondria. And so there's no way that we're not going to age better if we're getting more oxygen to our mitochondria. So this is a very important way to help with aging or anti-aging. So we want to do whatever we can to improve the function of our mitochondria. So we can do single or 10 pass. I guess I'll use this time to talk a little bit about 10 pass. So when I went to like I said, I came at this kind of backwards. I started with a real advanced course, and then I went to an even more advanced course. Then I went to the beginning course. So go figure. But I learned a lot. I mean, I felt over my head. The second course I went to was all on 10 pass. And here I just learned I just know how to give it to a joint. I don't know how to give it 10 times, and what's 10 times, and I watched them, and I listened to it. So what I've gotten out of the 10 pass is that If you think you get benefit out of oxygenating your blood one time, you're going to get a lot more benefit by oxygenating it 10 times. So I've got a machine I just ordered from Germany. It's on its way here. It's actually coming through Turkey to get here. None of the machines, by the way, are FDA approved. This Ozone is not FDA approved. Neither are stem cells FDA approved. The FDA is totally ignoring this whole subject. So you just have to realize these are things that we're kind of saying we're stepping out of the mainstream here to be able to offer. So the 10-pass is a machine that you hook up, and when you, it has a little egg, and we hook your blood, so it has a little tube coming down to your blood. The blood has a suction, so we turn the suction on, it sucks your blood out into the egg. Then we put the ozone into the egg, we kind of shake it around, and then we turn another button and it pulls your blood back in. It's pretty simple. So it's a little more simple than what we're doing right now, which is where we're using a bag, an IV bag, and then we get the blood out, we let gravity pull the blood out. This is actually using a suction device to kind of get it out faster. If people have to have pretty good veins to do this. And then we ozonate it, put it back in. We can do this as many times as we want, back and forth, back and forth. So we could do 5 passes, you can do 2 passes, you can do 3 passes, you can do 10. No one's doing much more than 10, except there's a guy named Robert Rowan, which we'll give you his number at the end here, who I went on a video of his the other day. He's like kind of a crazy guy. He's really but he has people coming to him from all over the world. He's curing Lyme disease with this 10-pass. He said there's nothing more powerful to wake up the immune system than doing a 10-pass. And people are looking all over for who's doing 10 passes, and now we're going to be one of those places after we get the equipment to do a 10-pass. So
how long will it take to do this?
Actually, it only takes not much more than what we spend doing a 1-pass, because it's pretty fast. I mean, probably a little longer. We can do a 1-pass in how long, Bonnie?
30 to 45 minutes.
30 to 45 minutes. We can probably do this in about an hour and a half, 2 hours to do a 10-pass. So he's saying that people walk in, it's usually about the 5th or 6th pass that they suddenly go, holy smoke, what is this? I haven't done it, so I haven't experienced. I'm going to experience when it comes in here. And we'll have all of us, there'll be everybody lining up. Ivan's going to be the first one back there, I promise.
I'm always a given.
To get a 10-pass.
If it doesn't kill me, then you guys can.
But nobody's died yet from a 10-pass. There are some people out there doing something called DIV, which is where they're doing a direct ozone injection. So you take gas and you're injecting it directly into a vein. And you think, what? Wouldn't you die of an embolism or something, of gas going in? And the answer is no, but I guess there's been 1 or 2 people that have had a bad reaction to DIV. So the society that Schallenberger has is opposed to this DIV. Rowan, who is, like I said, he's this cowboy up here. He's up in Northern California, and he did DIV. He quit doing DIV once he started doing multi-pass. He found out that multi-pass was better than doing DIV. So that's what we are going to be offering, is that multi-pass. There's me in the sauna. So that was last night. And so, again, you have to be wet. So we have towels. You probably need a couple towels to sit on. One to sit on, one to wrap around your neck so that the ozone doesn't escape. And then we'll use one more towel on the outside to kind of keep the ozone in there so that it's kind of a tight fit. I was a little worried about smelling ozone because I'm pretty sensitive. You know, asthma has been one of the things I've had issues. I haven't had any real serious attacks in a long time, but I have a lot of allergies and a lot of have had asthma. So, and that's one of the people, they caution those of us who have asthma about breathing in ozone. We wouldn't want to just breathe ozone in. So I was a little worried, and I bought a bunch of masks for us to wear, and I didn't smell any ozone at all. It didn't bother me at all to do an ozone sauna. I was really pleased. Oh, no. In fact, I wondered, Ivan, are you sure that ozone's on? And he came to, oh yeah, he could smell it, but it was very faint in the room. So then you can't see this very well, but what they showed at the talk and what made me want to buy the sauna was the fact that there were black spots on the towels when people sweat, and they would get up and they didn't know where those black spots were coming from, so they analyzed those black spots, and those black spots were mercury, they were lead, they were all sorts of They were uranium, and I know that I carry a lot of uranium. I live where there's now that we do hair mineral analysis, my uranium was off the chart because I lived on well water for the last 30 years. Now this is not I'm not radioactive, and uranium hasn't been shown to be of any real damage, but it's still not a good idea to be carrying it. That we don't need to be carrying these heavy metals. So when I saw that, I went back to the back of the place and I signed up to get one of these saunas. So I felt like, wow, that is really cool. Not to mention, there's two aspects of the sauna. One I mentioned already is the fact that you don't have to get stuck, okay? You can do the ozone if you have bad veins or we just can't get it going, then you can do the ozone sauna. And then this piece of it was just amazing to me, how that they had analyzed those black spots to be heavy metals that coming out of people. So anyway, I thought that was exciting. So again, we can do ear, we can do rectal, we can do vaginal, we can do IV, and we can do now steam saunas. The steam sauna is probably not going to be ready for prime time till next week. We're still kind of finalizing, getting the room set up, getting the towels in there, right, figuring out what do people need when they do a steam sauna. That will be cash. We are billing right now for one pass IV ozone, billing insurance and just calling it that we're giving you fluids and we're giving you vitamins, and we're billing an insurance for one pass of ozone. When it comes time to the 10 pass, we're going to have to come up with a charge. I will tell you right now that some of these places are charging about $1,000 for a 10 pass. We don't anticipate anything like that. I hope to do it a lot less expensive because I feel like this is East County. We're not here to see, I'm not going to tell you I don't need money to keep this overhead going, but I also am not trying to make it so that, that I want to make it reachable by some people. But you got to think, if you could do a 10 pass once a month, it might be worth to invest into a 10 pass. And then also we've kind of come up with a fee for the sauna will be cash, and I was thinking this morning that about $40 to do a sauna treatment. If you want to start with a half of a sauna treatment, you could do the $20 to come in and do a sauna treatment.
But the insurance won't cover?
No, not the sauna.
No. But the other,
But one pass of ozone, we're billing insurance. So I wanted Dr. Patel to talk about this because she's better on the physiology of this. I might add something, but I'll let you do this a little bit.
Sure. All right, so we've talked a lot about ozone and how many things it benefits, but I'm just a very simplified version of why it works for every cell and for every condition that we're doing. So imagine this as a big cell, and this circle right in here is the mitochondria. The mitochondria is in every cell, and its job is to provide energy and function. So if your mitochondria work, that cell will work well, whether it's in your liver, in your skin, in your brain, in your heart. So we want the mitochondria to constantly have energy. And in order to generate energy and then function, you need to have oxygen. So anytime you do anything, it's like breathe, breathe, breathe. We talk about this with exercise, with anything. So oxygen is great, we want to get it in, but ozone is that charged oxygen. It can get in better, it can get in faster. And it works by helping glucose and fat get into the mitochondria, because those are precursors to helping get into your energy cycle and help you generate better function for the cell and make ATP. So the highlighted parts are where ozone tends to work. And this is a very simplified graph because there is a lot more to how ozone works. But essentially it helps get glucose in, it kind of helps drive all the ingredients in for your mitochondria to make energy and improve function. It also is more powerful, like your lungs. What if you don't have good lungs and you don't oxygenate well? Okay, well I'm going to give you better oxygen. What if your circulation's poor? What if you take medication that's stagnant? What if your blood's thicker? Anything that can influence you carrying oxygen, we're going to improve because we're giving you charged oxygen to get in there. Okay, so this is what it's important. Now, what I've not included on here because it's really hard and it gets cumbersome, but I just put a little inclination of it, is that ozone is not the only thing that you need to work. That's not the only thing that's going to get your cells going. Hormones play a big part in it. So making sure thyroid is balanced, insulin is balanced, other hormones are balanced, do influence the way ozone will work too. So it's not just by itself. But the physiology is important because understanding that this is an every single cell in your body level helps. And that's why systemically it works, but it takes a while systemically because maybe you have like many things going on in your body. With the injections right into a joint or something, we're just focusing right there. So a lot of times you see the instant change with improving oxygenation and instant improvement in pain, whereas systemic things take a little bit longer. So this is really, like I said, this is very important, and there's really much more to it, but I just try to simplify how this works and why it works.
Yeah, thank you. One of the things I'll mention is that when we first did our first sauna treatment, we were disappointed that there was no black spots on our towel. And I read after I did that it takes a while for you to get to that point when you're really detoxifying. So it'll probably not happen the first time you sit on the towel. So I wanted to mention that. The other thing I wanted to mention is that on her graph, on the graph, when I went to Schallenberger's course, what really struck me for the first time is a little bit more why it works. What Schallenberger's really good about teaching is that why. And that was very helpful to me because I think I had, even though like I said, I came at it backwards, I went to the more advanced courses of people that already knew about it and why and how to use it. And now I wanted to know, why is this working for so many different problems? And that really helped me. And this diagram came from Dr. Schallenberger's course, and there's a chemical in your body called NAD, and it needs to be recycled back to NADH or NADH back to NAD. I don't remember which it is, but I always get that backwards. But that's what ozone helps do, is facilitate that transfer of NAD back to NADH. It also facilitates part of your immune system. What I was reading even last night about is part of your immune system gets stuck in something called Th2, and there's Th1 is a healthier place for your immune system to be in. And this in ozone does help push us from Th2 to Th1. So those are things that I thought, oh, that's why it's working. It was like, oh, okay, now I wish I would have done this course first instead of coming at this the way I did. But I got, what the first courses that I did for me was made me come back and going, oh my gosh, you're not going to believe this. Oh my gosh, the kinds of things that people are doing, the kinds of things that people are seeing, just blew me away. So it made me know I wanted to do it. I just had to kind of learn more the basics of it. So we've learned a lot in the last year. Yes?
I was just wondering how this compares in effectiveness to other oxygen therapies like an oxygen chamber.
Like hyperbaric oxygen.
Right, yeah, how does it compare?
So, well, I don't know if there's been studies. There's a lot of the people that are doing this combine it with hyperbaric oxygen chambers. So, I mean, I think that it is another way to get oxygen into the tissue, and I don't know of a study that's been to say, is this better or is hyperbaric oxygen? You know, a hyperbaric oxygen chamber, one, I don't have a place for a hyperbaric oxygen chamber. Watch out if I don't find one, though. I don't know. And then also, you know, they're $20,000, $30,000 for a hyperbaric oxygen chamber. So this is something that the average person, I mean, I've seen one of my patients a long time ago who's no longer with us, went to hyperbaric oxygen and spent, I think, close to $20,000, $30,000 for hyperbaric oxygen treatment for his bad circulation in his legs, and I never saw it get any better. I'm thinking back on it, how ozone would have worked for that. Did you have anything?
One of the things that he had mentioned, because he did talk about the hyperbaric chamber, is that is oxygenation. You are forcing oxygen into the tissues, but it's not the reactive oxygen that you get with the ozone.
Okay, thank you. I know we talked about it, I just couldn't remember what he said about it. Yes?
I read the other day that over the objection of doctors, some patients who had metal deficiencies, like getting into the Alzheimer's and so on, insist on a hyperbaric oxygen, and it turns out that they benefited significantly.
Oh, yeah, no doubt, no doubt.
The doctors objected, and they said, oh, it won't do you any good, and they said, no, I want to try it anyway, so they finally talked to them.
I mean, I'm hearing good things, especially on the 10-pass with dementia, and they're using 10-pass also with autistic. I mean, holding a kid down for 10 passes.
How about stroke?
Stroke, yeah, they're using it for. There's nothing they're not using it for. I mean, as far as, and I think that when you have a major crisis like that, then the more passes you could do, the more ozone that you can get into the body, the better off you would be. So. Any other questions? You got?
I just want to.
Oh, yeah, so one of the things when I went to Dr. Schallenberger's course, what struck me there is that you can't just say this is a magic bullet, you don't have to do anything else right. You could just go get ozone and then eat a crappy diet and not take any supplements. that isn't gonna work, okay? So it is an adjunct to good healthy eating, to good supplements, to getting exercise. There's nothing that helps you build mitochondria and keep those mitochondria better than exercise. But why is exercise so good? It's oxygen. That's what we're doing when we exercise. We're getting oxygen to those tissues. So combining this with other good habits, and getting enough sleep and making sure, hormone balance and stress. I wonder where's our Reiki? There's our Reiki lady. Can you come up here for a second? Just go around, I guess. So one of the other additions to the practice, as you know, we are always adding different things to the practice to make it a little better. And this is Mary Sotelo. And Mary was with me over in my other office many years ago. And then she went on her way and was doing different things. And I'm asking her, and then she came back and she offers something called Reiki. And what she mainly teaches in her Reiki therapy sessions is breathing. So that's, most of us aren't breathing well enough. So again, how do we get better oxygen into our tissues? Stress reduction, relaxation, breathing. So Mary, can you tell a little bit about what Reiki is?
Reiki is a practical healing art. It's very practical for our time. It's the ancient art of hands-on healing. You receive Reiki, so it's a relaxation. And in the relaxation, laying on a massage table, fully clothed, we're infusing the body with Reiki, life force energy. And in that process, your body begins to open up. The chakras begin to balance. Chakras are simply the portals that allow the energy to flow. And in that flowing, your organs are fed, your emotional body is fed, your mental state is balanced. So as the body receives, it innately wants to come into balance. It begins to receive the oxygen, the breath, the life force that we need to be in balance. When she was talking about the breath, as we breathe, our breath is Reiki. Reiki is life force. Our breath is life force. So we can go, 30 days without food, 3 days without water. We can only go 3 minutes without breathing. So in every Reiki...
3 minutes.
Yeah, right. So in a Reiki session, I'm supporting you and really kind of awakening to your own body awareness, connecting to your own body so you can feel and bear witness to those places where we're holding tension or tightness or stress. And by bringing Reiki energy through yourself, through your own relaxation in your own hands or your breath, it opens and releases that tension, whether it's a mental worry, indigestion, life changes. Just, life can be very stressful, so it's a way to support us and bring us into balance.
Thank you. And Mary, when she was with me years ago, at that time I was trying to add a counseling element to my practice, and Mary is a marriage and family counselor too. But what she does, Reiki is her passion. Reiki is, but she's very fully equipped to handle what comes up during a Reiki session, because what will come up during a Reiki session will be things that we're anxious about. Things that we're worried about. So Mary's very capable of handling what comes up during a Reiki session. So, and this isn't something we can bill insurance for either, just like, that we're not doing therapy here, and that's where why it didn't work when I had her with me years ago, is we tried to run it through some insurance, and we just can't do that.
How do you spell it?
R-E-I-K-I. And so, but she is offered to do, she's here, what days?
Monday and Wednesdays and or by appointment.
Yeah, and so she's offered to meet with people, we have cards from her, and do a free 15-minute session with you for you to get an understanding what Reiki's about. And then you could set up, and we have the costs of Reiki and how much, what that she charges for that. But I think it's such an important, there's no, how many of us aren't stressed? I mean, all we have to do is turn on the news and be stressed. I mean, holy smoke, the world is a very stressful place right now. I mean, to wake up yesterday with another mass shooting and all the other things, and have such a politically charged environment right now. Most of us are stressed just watching the news or being involved in it. So I think that having a way to deal with stress is just so important for us. So thank you.
I think I would close with, we were never intended to carry stress in our body. We were always meant to feel and let it flow through us. And so it's a perfect healing art that helps us with that.
Yeah, and it was such a perfect thing to add to the practice. I felt like it was something we needed, and she just showed up again in my life. And it was just at the right time when this office is here, and we had a little staff meeting right before we met here, and I just want to express such gratitude to all my patients, to all my staff, to what we were able to accomplish to be in such a beautiful building as this. I'm just really grateful that I've been able to accomplish it, and I think if this wasn't with right motives, it wouldn't have happened. So I think that most of you realize that my motives and the motives of this practice have been right, and that's why this practice has been successful and why it continues to be successful. I've been a little worried to market very much because we haven't had enough providers. I'm hiring another nurse practitioner soon, and I hope that, and obviously, my practice is the MDVIP model, and that's only because it's a way that I can spend as much time as I want to with the patients that decide to join that. So those are patients that I manage, but I have other providers here to be able to deal with some of these other issues. But I felt like I wanted to limit as I get over not working quite so hard. I've worked hard quite a long time, and for me to have 3,000 people depend on me was getting to where I couldn't really do it. Now I have about between 200 and 300 that I manage their health, but I manage that pretty completely. I mean, that, they call me at night, they, have that 24 hours access to me. So I wouldn't mind building that part of the practice, but I'm not here I don't care whether I do as long as this model stays and that we can continue to have practitioners here that want to offer to work with patients like yourself. So no one here in this practice is going to feel what they feel in other practices where they, have a minute or two with the patient, we have a problem, here's a pill, have another problem, here's another pill. We're going to try to look at the cause, see how we can better support you becoming healthy, work with you on that journey to becoming healthy, and we're very proud and very humbled to be able to continue doing that. So I want to thank all of you that have been involved with me for a long time. Some of you go back a long way with me. Judy, I know, goes back a long way. You go back quite a long way with me, and have seen a lot happen over the years. Yeah, so thank you for that. And so we have any other questions?